As we begin today's meeting, I want to make note that May is Mental Health Awareness Month. Mental Health Awareness Month was starting in 1949, 76 years ago, by Mental Health America to raise awareness for mental health and wellness. And I'd like to offer a point of privilege to my colleague, Commissioner Boyce, but before your remarks, I want to take a moment to say, as someone who has spoken publicly about my own mental health journey, being diagnosed with depression and anxiety, I appreciate your leadership in this space. Your efforts, especially during Mental Health Awareness Month, reaffirm something we all know, that mental wellness deserves consistent, compassionate attention, and that leadership on this issue starts right here in county government. Because if not us, then who? I commend you for bringing forward today's Mental Health Monday resolution and for taking a bold step with the upcoming Soul Talks Empowerment Summit. Your leadership is helping to keep mental health at the forefront. It also, by having these conversations and by talking about mental wellness, one, I get to heal out loud. I know that and I've talked about this before, a 2-time suicide attempt survivor, being in the shadows or not talking about not being okay or only perpetuates stigma, right? And it doesn't give other people the ability to say that they're not okay and to seek help. So that's why I share my journey. If I could just save one person, then I feel like I have done my job. I know what it's like to not be okay. I know what it's like to struggle. I know what it's like to feel alone or feel like nobody understands what you're going through. And so to talk about this and to put together a summit and giving people a space to be in community with others, to feel like they are surrounded by community, but more importantly, support and have the resources that they need to take advantage of their own mental well-being is absolutely commendable. And so I thank you so much for your leadership in this space, and I thank you for the summit that we're all looking forward to on Monday. So with that, Commissioner Boyce, the floor is yours.
Thank you, President Crawley, and I'd be remiss if I didn't begin my remarks by thanking you as well as Commissioner O'Grady. First, for yourself, actually, let me start with Commissioner O'Grady. For Commissioner O'Grady, he doesn't know this, but he's been an inspiration to me in this journey when I think about resilience. Most people know of Commissioner Grady's challenge and struggles health-wise. Going back a few years ago, he's talked very publicly about it, so I'm not violating the HIPAA laws here. But he's been very public about it. But not only that, he's been an advocate to people around him about getting screenings, about getting medical resources that might help their life, expand their life. But linked to that is mental health. Linked to physical health is mental health. And so I want to start by thanking Commissioner O'Grady for his resilience in his entire health journey, which includes mental health. Then I'd also like to thank Commissioner Crawley. Commissioner Crawley was one of the very first people that I've seen in public office to be that I've been connected to. I know we know of the U.S. Senator that's talked about it publicly, but she was the first person that I've seen in local elected office talk very openly and publicly about her own mental health journey. And I remember the first time you talked about it up here, Commissioner Crawley, I was really moved by it because I thought, man, that's brave. It takes a lot of courage. But moreover, it said for me, to myself, that I need to begin to think about what that means for me and the voice that I can have. And it started off with a conversation about Black men and the challenges that we in society deal with, not just Black men, but in society deal with Black men in general. Every statistics I could run through and illustrate what I mean by that. I won't do that right this second. They're easy to find. But I remember you speaking about it, and it led me to think, what could I do? And so we started to have a conversation. People like David and Aaron and DCA Bivens and others have been huddled up for the better part of a year, quite honestly. And so on this May 19th is the crescendo of the entire discussion that started with Commissioner O'Grady's resilience and Commissioner Crawley's courage and bravery, but to really convene a conversation about doing more by our residents in the area of mental health. And so we started off a conversation at City of Grace. Pastor Young was so gracious enough to host us there. It was a fabulous event. We had 800 people show up. And we're really surprised, Commissioner Crawley, at the level of engagement. I can't tell you, you talk about wanting to touch one life. You have, because it's allowed me to be empowered to do this. But I can't tell you how many dozens and dozens and dozens and dozens of people have come up to me throughout this process and simply said, thank you. Thank you for the conversation. Thank you for giving me some guidance and direction. And I feel like we just get started. I really feel like all we've done really is talk about it and provide resources. But I guess that's a part of the journey. And so, and you're that inspiration for that. So on May 19th, as we celebrate Mental Health Month and recognize Mental Health Monday, as we have been doing, this Monday, May 19th, we will convene at the Columbus Convention Center to really provide people to the clinical resources that they need. And it's not like you're going to go there and you get a therapist assigned and you go sit in some room and work through things. It's more of a forum so that you can see the pathway to access resources. B, you can hear like conversations of we did a guardianship panel at one time, what we call Soul Talk, and that was probably the more touching for me because I learned the most in that one about people who take care of other people. And so the idea of Monday is that there should be something for everyone. There are, I'm going to make this up, David, maybe 20 workshops, breakout rooms of some sort, something like that. Yeah. And so you can just imagine the range of topics and discussions. And I remember Commissioner Crawley said to me at one point, we were going through, she said, hey, don't you forget about veterans, don't forget about veterans. And so we've worked in a veteran component that I think you'll like. I don't know if you know yet, but we are trying to coordinate you hosting a breakout session. This just came about the other day. So this may or may not work out, but we held it up and reason why I said that is because Commissioner Crawley is very advanced in the conversation around mental health. And she is, you wouldn't know, I don't know if she does have any training, but it seems like it. When you talk to her, she's very, I would say, experienced, advanced in the conversation. And so we have an idea for a breakout group that I think we'd like to host. So that just came about. Sorry I had to do this publicly to you. You'll consider that. But let me just conclude on this by reading some of the resolution that's here today. And I just can't thank enough all of the staff, Joy Bivens, that have put so much time and effort into this. It's a week out, and we have over 1,000 people registered. So I think by the end of the week, I mean, the room holds 1,500. So I think I feel pretty confident. Joy Bivens said to me, we're almost at 1,100 right now. And I said, okay, only 400 more to go. And she just looked at me like, oh, yeah, we're working on it. Because I know it's there. We've got a seat for everyone. It's free. And there will be a lot of resources there. One of the things I'm most proud of that we produced is a mental health and addiction services resource book. It's kind of like a Yellow Pages type of situation. I'm really excited about that. This will be the first year. Adam H. does it regularly, but we kind of took it, revamped it, amplified it. And it's a work in progress. I don't think this is the final year. Next year it'll get even better. But I'm excited because you can take that book home. You can look at it in your own privacy of your home. You can pass it on to a friend. You can suggest to a friend other resources, and I think it's just going to get better. So, so first, this is Mental Health Monday, and we're recognizing May as Mental Health Awareness Month. Whereas mental health challenges affect nearly 1 in 5 adults in Franklin County each year, yet stigma, systemic barriers, and limited access to culturally relevant care continue to prevent many residents, particularly in communities of color, from receiving the help that they need. Whereas the Franklin County Board of Commissioners has consistently prioritized behavioral health support, from launching the Credible Minds platform, which you're going to hear more about on Monday, as a free mental health wellness resource, to supporting the Adam H. Board's crisis services, community mini grants, and diversion initiatives. Whereas data from local agencies and the National Institute of Mental Health show that over 40% of individuals with a diagnosable mental health illness do not receive the adequate treatment that they need, highlighting the need for continued investment in awareness, access, and education. Whereas the Soul Talks, Empowerment Summit, and other initiatives across the county serve as crucial platforms for destigmatizing mental health, building strong minds, and promoting culturally competent community engagement. Whereas the Franklin County Commissioners and the County Administration have regularly voiced their commitment to addressing trauma, supporting veterans and first responders, empowering our young people, and honoring recovery journeys through policy, funding, and public awareness. And finally, whereas the creation of Mental Health Mondays offers Franklin County a recurring opportunity to spotlight resources, share stories of resilience and courage, and empower individuals to prioritize their well-being, whether they're through therapy, self-care, peer support, or open dialogue. Now, therefore, upon a motion by me, Commissioner Boyce, and seconded by Commissioner Crawley, that be it resolved by the Franklin County Board of Commissioners to recognize that every Monday as Mental Health Monday in Franklin County, in order to honor the collective efforts to build a healthier, more supportive community, and to encourage all residents, every resident, every single day, to take one step each week toward improving their mental health and their physical health.
Thank you. Did you have any comments?
Apparently, I'm presenting this to myself, so.
Yeah, go ahead, DC Bivens.
Thank you so much, Commissioner Boyce. Joy Bivens, Deputy County Administrator. For the public, I want you all to know, on May 19th, from 9 a.m. to 1 p.m., we will have about 300 youth and over 200 seniors. That 9 a.m. to 1 p.m. session is designated for an intergenerational convening. At 3 o'clock, it is open to everyone. The youth can come back, seniors, veterans. The veterans are in the morning as well, but it's throughout the entire day. From 3 to 8, the entire community is welcome. One of the sessions I do want to hit on, if I could, just really quick, there is a session being conducted by one of our own, Jahid Harvey, who is going to talk about being a father there's going to panel, I believe, of talking about parents who have children who have been diagnosed with autism. Mm-hmm. Many times, a lot of folks feel isolated in that space when they receive that diagnosis, and they don't know what to do, who to talk to, what their community should look like when they're, trying to express themselves. Coming to work can be really heavy. So that is one of the sessions that will be taking place. But there is something for everyone. So again, 9 to 1 for our intergenerational convening for our youth and our seniors, 3 to 8 for the entire community. If you are a provider in this room today, and you have a vulnerable population that is prohibited maybe because of transportation or other barriers, David, can you stand up really quick? Please see David. This is the People's Franklin County Community Health, Mental Health Convening. We want the community there, in addition to our staff who are able to come, provided they don't disrupt operations, Chris Long, and they can get approval from their supervisors. But we want the community to show up in great numbers because there's so much that they can have access to. Maurice Claret will be with us on that day. National podcasters, Wallow Gilly, you can Google them if you know who they are. I think I'm too old. But Wallow and Gilly will be there. Dinner will be served at 6, and then lunch will be served for the young folks, I believe, at noon. Thank you so much, Commissioners.
Thank you. And I would just add that, it's important that we continue to have, or that we have Mental Health Mondays, and we can continue to promote mental wellness and well-being. As people may know, that when it comes to overdose and the opioid epidemic, the numbers have decreased, but the numbers have increased and continue to increase when we think about suicide deaths, right? Especially among men and especially men of color. We know that especially in our marginalized communities or even with our new American communities that suicide continues to increase in our new American populations. We cannot have a thriving community if we have community members who feel like they're not seen, they're not heard, and that they're left behind. And so we will continue to raise awareness. I love the Mental Health Mondays. So everyone in our community feels like they have a voice and that they're included. But there is an epidemic when it comes to suicides in Franklin County, and that number continues to increase, unfortunately. And we absolutely can do something about that and turn the trajectory around. So, thank you.
This is also not simply a Franklin County issue. This is an issue that's dealt with across the state and across the country. I talk with colleagues at NACO, and this is an issue that our colleagues all across the United States are dealing with and have been dealing with for a number of years now. And it is on the rise, as we all know, and we've discussed this morning. And so, thank you, Commissioner Boyce, for highlighting this issue and for bringing this to all of us here. But when we gather across the state and across the country, this is an issue that we all know and we all recognize. So, thank you.
When you were leading Luck and focusing on infant mortality, the leading cause of death in the state of Ohio for women, pregnant women and postpartum women, is mental health challenges. And so when we think about making sure babies reach their first birthday or that we have healthy families, this is the leading cause of death. So.